we have, last but not least, the exciting, the dynamic Ryan Moore. Dr. Moore is just, you guys have heard him speak with Mended Little Hearts many times because he's so exciting and interesting that we always like to invite him back. He's going to speak right now on using game engine technology to plan patient-specific congenital heart procedures. So with that, Ryan, I'm going to stop sharing my screen and send it over to you.
All right. Can everybody hear me okay? Jody, can you hear me? Okay?
Yes, I can hear you.
Perfect. All right, I'm going to go over to the presentation mode. So thank you all. These have been some great, very, very good lectures that I've got the opportunity to listen to in between reading Echoes in the Echo Lab. So I took a mini break there to kind of share with you some of my passions here. So I have no disclosures that are related to this presentation, but I do have to disclose that I am a recent children's book author for Hank the Heart, and that is something that the portions of the proceeds go to congenital heart differences, as we like to call it, health literacy projects. So take notice, and you will probably pick this up very quickly as I am going through my presentation. I am a failed arts design major turned pediatric cardiologist. And then the other part is that I played a lot of video games growing up and got a lot of threats from my mom and my grandma and everybody else that if I do not stop playing video games, I will amount to nothing. So I decided to make that a point in my life to prove them wrong. So my recommendation, as I now have my own children, and I do see that there is a dangerous side to video games and screen time, and as a pediatrician, it's my responsibility to monitor screen time, is to support your child's healthy video game habits to a certain degree. What that means, I think we all have to figure that out, as we go along, but there might be something, that your kids start to ask and have some more ammunition about why they can play video games after watching this. So this may look familiar to many of you. I'm an 80s child, so Toys R Us will always be near and dear to my heart. But you may see things like the PlayStation, Xbox, Oculus VR headsets, and Steam credits coming up on your hot toy list or hot game list for this coming holiday season. And, don't be too afraid because most of the stuff is sold out anyway, so it doesn't really matter. But you can't really get the PlayStation 5 or the Xbox, or at least that's what you got to tell your kids. That's what I'm telling mine. Video game engine technology is revolutionizing multiple industries. And we talk about game engines. There's two primary game engines that are leading into things like PlayStation and Xbox, and that's Unity and Unreal. What's interesting is you see a lot of technology that comes into the hospital systems, and you will be surprised, but maybe not too surprised, that this stuff starts at around like $50,000 to $100,000 to even more hundreds of thousands of dollars to implement within your hospital system. My question to that is why would we do that? Not only because that drives up the cost of healthcare, but there's also relatively inexpensive, very good platforms such as a $500 PlayStation or Xbox. So my prediction is in the next 10 years, every hospital will have a PlayStation and an Xbox in there that will be being used to run some platforms, or they have these kind of fancy gaming computers. So kind of just to start to give you an example, here I'll just jump over to this Microsoft Flight Simulator. This is an example of a game right now on Xbox that many of you who may have experienced Flight Simulator from before in the old days, just going to turn down the skip over to some things of the you might see in the cognitive. Some of this is training. And so is congenital heart surgery next? Absolutely. And we've already started to do a lot of this. I know a lot of other centers are also evaluating this type of technology where you can actually take it and plan a patient-specific operation using virtual reality or augmented reality in a very timely fashion. And so the historical way we did this we would take the medical imaging data like a CT or an MRI, or it has to be a 3D type of format. So 3D echo would be another opportunity. And then you would create a 3D model off of it. And so many of you have probably seen this either in printed form or in digital form. And that's something that we do use very regularly. The next step is really to build these into what we would call XR compatible game engines. And so the other things that we can do is we can enhance these with animation techniques, just like what Pixar and Disney and DreamWorks and the like do. And so there's a couple of things that we need to do in order to bring this into a game engine. A lot of our models come out with a lot of, this gets into my kind of art design phase, but a lot of triangles or polys, as we like to call them. And you'd have to reduce those down so that you can improve the performance to be able to work with them. The next part of this is working with different types of physics. So we all know that the heart is pumping blood and it does a very great job at that. So there's fluid that needs to happen. There's also other types of motion as the heart muscle contracts. We have to be able to replicate that. So video games, sadly, are way ahead of healthcare when it comes to this. This is an opportunity for us. And so I'm going to quickly introduce what extended reality is, just because then you can sound cool to your kids as you're looking at the shopping list this year. But there is virtual reality, which is immersive and interactive, or immersive interactivity. Augmented reality, Pokemon Go is a good one that everybody's familiar with, where it's more of an overlay of your atmosphere. And then mixed reality, which is more integrative. So it's an object that, has different touch points. And then you can see this sometimes, there's new books and other types of things that can come out with some mixed reality. So we have done some mixed reality. This is Dr. Morales here working with the EchoPixel station, and you can actually integrate and work with the models directly on that, and this can be live, and this is something that us and other hospitals will have live in the OR to be able to interact with the imaging data.
So
then
your
there's
eyes,
augmented
no,
reality.
it's
And
not
augmented
touching.
reality
So
is where
if
the
you
headsets and
look
things
to-
are projected off, and you can also project onto different things. This is from Dr. Nilesh Guri from Toronto, who shared this with me, and using the Microsoft HoloLens for display over the heart model that he created. And then virtual reality is probably the fastest to grow, just because the way that we have the headsets and the availability of this, and the way that a lot of our developers work, they're very comfortable with the virtual reality process, because it's very much like a video game. And so this is Dr. Morales and in his office planning out a VAD placement. The nice thing about this is that I'm an imaging person. I'm someone who's played a lot of video games in my life, and I know how to work with 3D data. Surgeons really are very good with working with 3D, in real time in the operating room, but not so much on a digital level. But virtual reality really bridges that gap, because this allows them to use their hands as they're planning things out. And then the other nice thing about virtual reality and some of these other ones, you can do a multi-user experience where you can have, we're working now with Sheba in Israel, where you're going to have surgeons on one side over in the US and surgeons over in Israel or other places, and then also within the US, different centers can get into this environment and then can share discussions about a case, can do any sort of kind of, second opinions, referrals, that type of thing, and really just go over this anatomy and really just optimize what our plan is. So I'll give you a couple cases just to show you how we have used this. The first one is a ventricular assist device placement in a Fontan. And the question for this was the best position for device in a single ventricle. So we did use this kind of holographic display. This is a very quick and easy way to do it, where you take the device, you move it into this position, and then you can see, is it an optimal position? This patient had some increased muscle around that area. So that was something that was going to be noted in the operation to be taken care of. And exactly as we kind of identified, and we did a little bit more detail on this, we were able to pick the correct position. It just makes the procedure go faster. And ultimately, the main goal is that we're reducing complications and any sort of reoperations by optimizing what the approach is going to be. We're able to then put this also into this virtual surgical simulation suite, or as we call it, the VR3S, where we can actually take these devices. And again, you can take the devices. This is one of our very early iterations. We started to do this work about 2 years ago, and just have continued to build on it, as you'll kind of see today. And this is one of the early ones where we did, again, a device placement. The next one would be a double outlet right ventricle with a large ventricular septal defect. So a question here has been pointed out, I think, a couple times today, is it going to, could this be a one ventricle versus two ventricle? I think that, like, as was mentioned by one of our surgical colleagues earlier, there's a lot of patients now that are being considered for 2 ventricle repairs. This is what we used to have to work with to be able to plan that out. And this is, an echo that we're all familiar with when we get to see kind of the snowy pattern. Something that's near and dear to my heart is my family, my mom, my sister are both sonographers, but it's just not the optimal way to plan out an operation. What you really want is a full, complete model, which is what we've done here, based off of, this one's based off of a CT scan, but you could do CT or MRI, and I think eventually you can do 3D echo, where you can actually go in and you can place what that patch would look like and where that patch is going to go to. You can then also plan things out. This is in the virtual environment, where the surgeon, again, is going to be able to look at the anatomy in complete detail, and then also be able to place things like the patch. The next one is a very rare type of congenital heart difference, which is Truncus Arteriosus with an Av canal. These don't come along very often, and so the surgeons really need a lot of, I think, mental preparation, but also a good plan going into place about what you would do. So this was the first time that we applied this to something this complex, where he would be doing a VSD repair, an ASD repair, a left superior vena cava baffle, and then also an RV outflow tract conduit. I'm sorry, that should say RV to PA conduit, not RV outflow tract. Too much echo reading today, I suppose. So here we can again see the model in full form. We've actually modeled out the valve as well, and we can place where the patch is going to go to. We can place, there was a smaller atrial patch. So when we're describing this to families, it's not so much that we're using things like, oh, here's this inlet VSD, here's the, other portion of the VSD. We can actually show them, say, this is a hole, this is where you're going to need to put a patch. This is a hole, this is where we need to put the patch. And we get better, I think, an overall on the same level of what we're describing, which I think is what needs to happen. And then here's the place where we're placing a conduit and what that would look like. So that's that operation then planned out. Oops, just move on to the next. Let's see here. See if I can. Just got it. Just gonna go out one quick. Oh, that's perfect. Okay. And then this again, same thing, but in that virtual environment like we were describing before, where the surgeon can get in there and can really see it in this virtual environment and plan out different locations. So again, the previous thing was the animation form on a computer, but now this is in a virtual headset where the surgeon can look in detail and make different notations and marks before the operation is done. The next one is a Fontan patient with 2 good-sized ventricles and was failing, and this was actually a teenager, and the question was conversion to a biventricular heart. So we don't do those very often, and so this was one of those cases which again was very rare for us, and so being able to be prepared for it was very important. And so here is what the animation form of it looks like, and the step-by-step part of this would go. And again, this is a patient's heart that's modeled. This is often an MRI. So again, MRI or CT will work. One of the first steps would be to separate this portion of, this is the neo-aorta. You can see, with 2 good size vessels. And, the next part, again, this helps for us too as imaging people, because we don't always know exactly what the surgeon's talking about when they're talking about that they're going to do these repairs. So do not think that you're alone in not understanding, what is going on in terms of the process. But this was very helpful because this really, I think for our discussion purposes, helped everybody to see and understand, and I think ultimately make a safer environment, for the patients, because everybody understands what the steps are. So here's a conduit being placed. This is over to the branch pulmonary arteries, and here's the conduit that's going to be plugged into what is now the new pulmonary artery. So the blood, so it would be going out to the lungs. This portion that's left here would become now the aorta, and then we would, bring these in and separate, or bring these in and put those together. And then here's the Fontan conduit, which we're going to just take away and remove. And the next step will be to plug in a conduit between the SVC and the atrium, and then the IVC needs to be plugged back into the atrium. So again, it's just one of those things. you know, I have my wife has had, you know, multiple surgeries for brain tumors, and, you know, thankfully she's doing well. But understanding that in the moment of shock of what they're going to do is incredibly difficult. So using something like this, even for consent, is very important. Some of you who may have been introduced to this, tetralogy of flow pulmonary atresia with MAPCA is a very complex heart condition, and they often need these different little blood vessels reconnected. And so when we say unifocalization, again, nobody knows what that means. I didn't know what it meant until I got into this. Again, I'm, you know, come from I did medical school and all that stuff, but, you know, when I think of things, I try to think of them in simple form on a visual level, but I don't know what unifocalization means. But here we're going to see exactly what it means as they're taking off these different branches and or these different collateral vessels. The way I like to describe these to families is kind of like you've got different branches of a tree and you're just kind of combining them together. So that one there was removed, and then here he's going to be placing a patch. This is something that this animation is then playing in the operating room, so everybody knows kind of exactly what the surgeon's thinking about what they're going to do. They know step by step. There's no guesswork. You know, we're trying to reduce any sort of potential errors that can occur there. We label these extensively so that we know that these are labeled as MAPCA 1, 2, 3. And so when the surgeon's talking about that, there's no confusion about what that means. And so again, pictures are worth 1,000 words. Animations and video games are worth, you know, for me, a lot more. But, you know, this is, again, something that is very much real now, very much something that we're able to plan these out right now. So do not think that this is too far away. So kind of one of my things, my what ifs is, you know, what if kids were able to learn about their heart differences when they were young? My goal always is to have a kid come into my clinic and say, as a 4-year-old, I'm a hypoplastic left heart with, I had a Norwood, a Glenn, and a Fontan, and, you know, what can you do for me today? And then I don't have to go through all the different parts of it. Love to talk more about it. We can draw pictures and do other fun stuff, but, you know, this is something that is, I think, very real today. As my kids tell me, whenever I punish them and say you can't watch YouTube or Netflix anymore, they always say, well, if I can't watch YouTube, then I can't learn anything. And so having this stuff available to them, again, once these animations are created, then that's available, I think, for the families to be able to have and own. And so you have that, and families have these animation-based surgical records to better understand what happened in past surgeries, and then also to, you know, just get a better understanding. You guys do such a great job, and I'm always amazed by like how well you guys are able to absorb this. And it's just one of those things where when you're in it and you're in the fight, you have to do it no matter how hard it is. Our job is to make this way easier for you. So a couple of things that I'm thinking of being able to do is we have, you know, 2 applications right now that we have out there that are free and available is Heartpedia and Surgical Animate. What these do, you're able to go in and select different general conditions. So obviously this is not a patient-specific heart. But one of my goals is, what if we could make this like a My Heartpedia, where you actually have the kid's specific heart in there, and so when they go into the doctor's office, they have that there. When they go into the emergency department, they have that there. And I always encourage all of my patients to select talking about their heart difference for their class every, you know, during school, because that's a guaranteed A. If a teacher does not give an A for that presentation, then I tell them, like, let me talk to the teacher, let me see, you know, what's going on here, because that's a definite A if a kid can go in there and explain that. And then just to end, you know, what are other ways that video games can impact our congenital heart different patients? The one way clearly that we have demonstrated, and I think others are looking into as well, and we're all kind of sharing this information, is doing virtual transplantations. So we can increase the donor pool, we think exponentially, by actually, instead of using height and weight, looking at the space and how the heart can fit into that space. So that is something that, again, we're all very much doing right now. These kind of game engine rendered mannequins for simulation. So believe it or not, this is a baby that we use as a mannequin for simulation. This is a digital creation that looks exactly like a real baby. We kind of nicknamed him Neonate after any of you that are Matrix fans, because it's a baby, a neonate. Haha, it's funny. And then also has, you know, some nice, you know, one of the goals with this is that we're going to be using this to train parents at discharge. And so when you're discharged, you will go through a simulation about what does cyanosis look like, because this is what digital and virtual mannequins can do. What does fast breathing look like? What do pulses feel like? Because we can actually plug into this so you can feel pulses and you can know what perfusion is. So when parents get discharged, they're going to be able to know what a baby looks like normally and know what a baby looks like in distress. And so our ultimate goal here is, let's get the parents who are the primary caregivers. It's not us, the doctors. The parents are the primary caregivers for these complex babies. Let's give them all the tools possible to be successful. And that's kind of one of the goals here. The other part are just fun educational stuff that I'm always a fan of. We have a Heartpedia Vr application that we're loading onto the Steam and Oculus store. And this is more of a fun kind of matching game where kids can then interact with others, their peers, their siblings, and really just have a fun time kind of learning about the heart. At least I think it's fun. You learn some stuff and maybe have to block that feature for some kids. But with that, here's my contact information. Feel free to reach out to me for anything. Stay safe, wear a mask, and thank you very much.
Thank you so much, Ryan. That was just so fascinating. I even hesitated to let you know that we were running out of time because we're all sitting there watching it, texting each other like, this is so cool. And our families saw Hank the Heart and they were very excited about that as well.
Thank you. I appreciate it.